It's definitely surprising that very few healthcare professionals discuss this. Pantoprazole, omeprazole, esomeprazole, lansoprazole, dexlansoprazole, rabeprazole, all they fall under the category of proton pump inhibitors. We are likely familiar with these medicines, having used them frequently for issues like heartburn, stomach discomfort, acidity, or even to prevent any of the symptoms from happening in the future. Some of you might have been on this medication for years, either prescribed by a physician or getting it over the counter and continuing to use it due to a belief that they are harmless. But is this perception accurate or should we be concerned? Let's explore this together. Hi, I'm your pharmacist next door and I help you live the best of your life, helping you make informed health choices. Proton pump inhibitors are often prescribed for conditions such as peptic ulcer disease, gastroesophageal reflux disease, Zolnitz or Ellison syndrome, a disorder marked by excessive gastric acid production, and also as a part of the combination therapy for the eradication of Helicobacter pylori, which is the bacteria that infects gut lining. They're also used alongside certain medications such as non-steroidal anti-inflammatory drugs that can cause gastrointestinal bleeding. Interestingly, these drugs are among the most overused and overprescribed globally, often without solid justification. In the United States, they rank as the most commonly prescribed medications, with 1 in 5 elderly individuals taking proton pump inhibitors long term. In the United Kingdom, their usage has skyrocketed from 0.2% in 1990 to 15% in 2014. This trend is scary, and guess what? We lack comprehensive data on its prevalence in other parts of the world. It seems that everyone we know are taking these medications because they are perceived as safe, which is actually true. Proton pump inhibitors generally have a benign safety profile, meaning that they are safe for short-term use with minimal side effects. However, their long-term usage without clear indication raises red flags. Long-term use of proton pump inhibitors may lead to several concerning side effects. Kidney injury. Studies indicate that extended proton pump inhibitor use may lead to acute interstitial nephritis, leading to kidney injury, osteoporosis, and bone fracture. Reduced calcium absorption due to decreased stomach acidity may lead to lower bone mineral density and increase the risk of bone fracture. This risk is seen to be time and dose dependent. Dementia. Some studies suggest a link between proton pump inhibitors and dementia, most particularly Alzheimer's disease, which is a neurodegenerative disorder impacting memory and cognition. Liver disease. Prolonged use of proton pump inhibitors may heighten the risk of cirrhosis associated with hepatic encephalopathy and may worsen the existing liver conditions. Macronutrient deficiency. Altered gastric pH may hinder the absorption of essential nutrients such as calcium, as discussed earlier, and also iron, vitamin B12, and magnesium. Increased infection risk. Long-term use of proton pump inhibitors causing gastric acid insufficiency might even impair natural defenses against bacteria, leading to issues such as Clostridium difficile infections causing severe gut issues and potentially pneumonia, as pathogenic bacteria might even aspirate to lungs. While concrete epidemiological evidences are limited, there are several studies which hint at these possible side effects. Therefore, it's crucial to ensure that these medications are prescribed only when absolutely necessary. Picking up one of the studies which highlighted that 80% of the doctors are unaware of proton pump inhibitors deprescribing strategies, and over half rarely review the ongoing indications for their patients' proton pump inhibitor use. This is certainly an issue that many of us as healthcare professionals can likely relate to. When faced with such concerning statistics, it's troubling that many continue taking proton pump inhibitors merely to avoid the fear of also complications in the future, even when they are stable now, or that the prescriptions are refilled without questioning their necessity. Given that some of these side effects may take years or even decades to manifest, it's essential to carefully consider the risk versus benefits of long-term proton pump inhibitor therapy. Choosing medication over making minor lifestyle changes for gastric symptoms is not justifiable. We need to ensure that these medications are used appropriately. This issue needs our urgent attention. Until next time.